Welcome to the IHH for Veteran weekly live stream. Here at IHH for Veteran, we specialize in assisting veterans with their physical and mental health transformation. This group addresses the unique challenges of veterans to improve their overall quality of life. Many veterans have expressed they have questions regarding cannabis and anxiety. So tonight, the live stream will be discussing cannabis and anxiety. This is an excerpt from the Cannabis Health Index by Hugh Bleshing, July 5th, 2022. Anxiety is a normal reaction to the subjective experience of stress, such as in performance anxiety. It can occur when anticipation of future events is associated in one's mind with thoughts and feelings not rooted in the present moment. While anxieties can be considered a normal part of life, chronic or consistent anxiety can be debilitating to one's quality of life. In fact, such interference can produce very real physiological changes in the short and long term. It is estimated that almost 2 out of 10 people in the United States suffer from anxiety disorder. Western medicine considers anxiety disorder mood disorder and defines in 5 basic types: generalized anxiety disorder, or GAD, obsessive compulsive disorder, OCD, panic disorder, post-traumatic stress disorder, or PTSD, and social anxiety disorder, or social phobias. Doctors often prescribe pharmaceuticals like anti-anxiety drugs or antidepressants, or a psychological intervention to treat anxiety, particularly when underlying physical causes are absent. Adverse effects of pharmaceutical anti-anxiety medication range from mild to fatal. A thorough risk versus benefit analysis is advisable before committing to such a regime. The science behind cannabis and anxiety. Even though the combination of cannabis uses and anxiety has been subject to extensive scientific scrutiny in the preclinical and clinical setting, the current state of the science of cannabis-based therapeutics in treatment of anxiety disorder is in its preclinical phase, yielding mostly negative, inconclusive, mixed, or contradictory results. This is presumably due to researchers' bias and/or concerns about working with THC, its potential for inducing adverse effects when administered in inappropriate dosages or forms, the relatively low but present addiction potential, or its risk of various more vulnerable cohorts, such as adolescents, pregnant women, or patients with a vulnerability toward developing psychosis, for example. The same, however, is not true for the use of CBD-based drugs or for the utilization of an essential oil of cannabis, where several clinical trials present as with more practical guidance. Here we review only the currently available randomized clinical trials that have directly examined the effects of modulating components of the endocannabinoid system, or ECS, in the treatment of anxiety. Double-blind, placebo-controlled trials. A team of researchers from Brazil in 2004 enlisted 10 healthy volunteers to test the effects of oral administration of a single dose of 400 milligrams of CBD or placebo during a typical anxiety-induced neural imaging procedure. Resulting data suggests that CBD has anxiolytic properties. The authors posted that the CBD-induced the therapeutic effects were mediated by affecting limbic and paralimbic brain areas. Another similar trial designed from Brazil in 2011 utilized 10 test subjects. This time, instead of healthy volunteers, the 10 patients diagnosed with general social anxiety disorder, or SAD, were given a single dose of 400 milligrams of CBD or placebo during a typical anxiety-induced neural imaging procedure. In this setting too, and relative to placebo, CBD was associated with significantly decreased experiences of anxiety. And yet another experiment from Brazil in 2011, 24 patients divided into two groups with general social anxiety disorder were given a single dose of 600 milligrams CBD 1.5 hours before a simulated public speaking test. The placebo group had higher anxiety, cognitive impairment, discomfort, and alert levels. In direct contrast, the group using CBD had significantly reduced anxiety, cognitive impairment, and discomfort in their speech performance, as well as decreased alert levels in their anticipatory speech. The previous test results were confirmed by collaborative data published by a group from Israel and Brazil in 2018, who enlisted 57 healthy males divided into 4 groups to receive oral pharmaceutical forms of CBD at dose of 150 milligrams, 300 milligrams, 600 milligrams, or a placebo before a simulated public speaking test. Researchers measured data on a subjective mood scale as well as obtained physiological measures like blood pressure and heart rate. Results showed that pre-treatment with 300 milligrams of CBD significantly reduced anxiety during the speech. The inverted U shape, indicating 300 milligrams rather than 150 or 600 milligrams as the most effective approach in this setting, suggests a specific narrow dose dependent therapeutic window. A group of scientists from Italy in 2018 tested the effects of essential oil of cannabis with the main terpene content of myrcene and beta-carotene by measuring autonomic nervous system parameters like blood pressure, heart rate, respiratory rate, skin temperature, mood states, and electroencephalography results or EEG results. But before, during, and after inhalation of the essential oil. Results suggest that essential oil of cannabis reduced diastolic blood pressure rates, increased heart rate, and significantly increased skin temperatures. Patient subjective findings were reported as more calm, relaxed, energetic, were in a good mood, and had increased feelings of hunger, and the subject with headache had no more pain. In addition, there were noticeable changes of band power, amplitude, and relative power in alpha, theta, delta, and beta waves, which were all like those noted in people practicing meditation, yoga, and mindfulness, for example. A team from Japan in 2017 tested a single dose of 300 milligrams of CBD in the treatment of 37 teenagers with social anxiety disorders. Results demonstrated that CBD significantly decreased anxiety and as such may represent a useful option to treat social anxieties. The right type of cannabis matched to meet the needs or preferences of each individual and given in the appropriate form and dosage produces a deep sense of relaxation and homeostasis. In doing so, cannabis can bring about a state of mind that makes it easier for challenging emotional material to come to the surface without the usual triggering of strong reactions. Cannabis is famous for its capacity to diminish chronic negative fear, like anxiety or anger, and replace it with a gentle attitude, an easy smile, and more optimistic outlook, all of which have proven to support our natural self-healing abilities. To schedule a complimentary assessment, go to my website, veteransvictories.org. Thank you and good evening.